In type 2 diabetes, the most common cause of death is cardiovascular death. The link is not only related to hyperglycemia, but also to underlying cardiovascular risk factors. So type 2 diabetes is associated with insulin resistance, which is associated with hypertension, and with particular dyslipidemia, high triglycerides, low HDL, small LDL particles. And this phenotype is associated with increased cardiovascular risk, about twofold the rate of the general population. As important, or arguably more important than managing glucose in patients with type 2 diabetes, is managing cardiovascular risk factors. So treatment with antihypertensive agents, treatment with lipid-lowering agents, specifically statins, treatment with aspirin in the highest risk patients, smoking cessation, etc. So cardiovascular risk reduction arguably is the most important part of diabetes management. Two of the most important complications of diabetes medications historically have been hypoglycemia and weight gain. So until the last 15 years, the medications that were available, sulfonylureas and insulin, were uniformly associated with hypoglycemia and weight gain. Most of the new drug development over the last decade has really focused on drugs that neither cause hypoglycemia or weight gain. We have good data that hypoglycemia is a barrier not only to physician prescribing medications and increasing doses, but to patients taking their medications. And weight gain is an area of tremendous focus of patients with type 2 diabetes who are almost always overweight and have struggled with their weight for most of their lives. The approach that I use in working with patients to decide on the next medication to take is one of shared decision making, where I review with patients the available options. Each has their advantages and disadvantages, and it's remarkable how some patients have a strong feeling about one drug being better or worse for them than another. So my approach is to generally go with the flow in that regard, obviously putting my spin on what I think are the most important issues. With regards to deciding about a particular drug in a patient with type 2 diabetes, one of the most important new factors that we're considering is actually cardiovascular risk. And that's based on the recent clinical trials that have demonstrated cardiovascular benefits, reductions in heart attack, stroke, cardiovascular death as a primary endpoint, and some drugs even showing a benefit on death in patients with prior cardiovascular disease. So that's a new and important approach.